We say that the eating disorder developed as the person's best way of coping at the time. And in fact, I sometimes say, and this sounds kind of dramatic, but I often say the eating disorder saved your life until it was killing you. My name is Nicole Siegfried, and I am a clinical psychologist, and I'm the Chief Clinical Officer for Alsana. At Alsana, we believe that everyone has an eating disorder for a different reason, and that the eating disorder serves a purpose and a function. And we have to understand what that is to truly meet the client where they are and to help them in their recovery. We believe it's important that even the group work that we do is very specific to the individual and tailored to his or her needs. And they get feedback from the other group members and from the group leaders on the experience and how the other clients may relate to that. And so this can be very powerful because it creates an environment where you have another witness to your experience, and also can reduce shame in that way, which is part of the process of recovery. Almost everyone with an eating disorder also has another disorder, what we call co-occurring disorders or comorbid disorders. And so the majority of our clients have either co-occurring depression, co-occurring anxiety. And so our clinicians are trained not only in eating disorders, but also in treating these co-occurring disorders. And so we integrate evidence-based treatments for those disorders, including acceptance and commitment therapy, cognitive behavior therapy, dialectical behavior therapy, and other interventions too that are more innovative. It's very important, we feel, for clients to get in their bodies as part of the therapy experience. So we do a lot of expressive work, including art therapy and psychodrama, and feel like those things also address these co-occurring disorders. To understand where the client is in the process, we have to be able to measure it. And so we do assessments at admission and at discharge to be able to see where the client is in terms of body image symptoms, depression symptoms, anxiety symptoms. And not only do we do that, but we also do this on a weekly basis so that we're able to see progress in real time. And so this week, this client really is having more binge urges or self-harm urges. And so then we're able to address those things specifically because we have that data that we're collecting along the way. We're always asking the question as therapists, what is the work that needs to be done at this level of care so that the client can get to the next level of care to do the work there? We know we'll have a limited time at each level of care based on the time the client is able to spend with us. And so we want to make the best use of that time. So we follow that treatment map in terms of the issues that need to be addressed and the work that needs to be done, the assignments that need to be given to get the person through that first level of care and on to the next. I often say that people with eating disorders, it takes someone with an eating disorder to be able to recover from an eating disorder, which is a kind of strange thing to say. But what I mean is the resilience and commitment that it takes to have an eating disorder is exactly what it takes to be able to recover.